Here is a scary but important fact that many people still don't fully understand. In 2014, nearly 46,000 Americans died from drug overdoses, setting a new and alarming record at that time. When most people hear this number, they immediately assume the deaths were caused by illegal drugs like cocaine, methamphetamine, or heroin. But when researchers and public health experts looked closely at the data, a very different and disturbing truth emerged. A large portion of these deaths were not caused by illegal street drugs at all. Instead, the biggest contributor to overdose deaths was something far more common, far more trusted, and completely legal: prescription opioid painkillers. These medications were written by doctors, filled at pharmacies, and taken by everyday people who were simply trying to manage pain. This raises a critical question that still matters today, even more in 2025. How did legal painkillers become one of the deadliest drug categories in modern American history? To understand how this crisis began, we have to go back to the 1990s. During that time, doctors across the United States were under increasing pressure from patient advocacy groups, medical organizations, and even government agencies to take pain more seriously. Pain was being described as the fifth vital sign, alongside heart rate, blood pressure, breathing rate, and temperature. The intention behind this movement was not bad. In fact, it was driven by a real and widespread problem. Nearly 100 million Americans were suffering from chronic pain conditions such as back pain, arthritis, nerve pain, cancer-related pain, and post-surgical pain. Many patients felt ignored, dismissed, or undertreated, and they moved from one doctor to another searching for relief. The medical community genuinely wanted to help these patients live better lives. Under this pressure to treat pain more aggressively, doctors increasingly turned to opioid painkillers. Opioids are powerful drugs that bind to specific receptors in the nervous system and reduce the brain's perception of pain. Medications like oxycodone, hydrocodone, and morphine were very effective at reducing pain signals, especially in acute settings such as surgery or severe injury. At the same time, pharmaceutical companies heavily promoted these drugs as a safe and modern solution for chronic pain. Some companies claimed that newer opioid formulations were less addictive and safer than older painkillers. Doctors were told that addiction risk was low when opioids were prescribed for legitimate pain, and many believed these claims. Unfortunately, those claims turned out to be deeply misleading. Later investigations revealed that some pharmaceutical companies had downplayed addiction risks while aggressively marketing opioids for long-term use. One major company eventually paid hundreds of millions of dollars in fines after being found guilty of making false or exaggerated safety claims. But by the time legal action was taken, the damage had already been done. By 2012, doctors in the United States wrote approximately 259 million opioid prescriptions in a single year. That was enough prescriptions to give a bottle of opioid pills to nearly every adult in the country. Opioids became widely available in homes, medicine cabinets, and communities across America. Because opioids are highly addictive, many patients who started taking them for legitimate medical reasons developed dependence over time. Some needed higher doses to achieve the same pain relief, a phenomenon known as tolerance. Others found themselves taking the medication not just for pain, but to avoid withdrawal symptoms or emotional distress. As opioid use spread, overdose deaths rose sharply. By 2014, nearly 19,000 overdose deaths were directly linked to prescription opioid painkillers, accounting for about 40% of all drug overdose deaths that year. This was not an underground drug problem. It was happening in plain sight. As awareness of the crisis grew, doctors and regulators began to change their approach. Prescription guidelines were tightened, monitoring programs were introduced, and many physicians became more cautious about prescribing opioids. While these steps were necessary, they also led to unintended consequences. Many patients who were already dependent on opioids suddenly found it harder to access prescription painkillers. Without proper addiction treatment or alternative pain management options, Some turned to illegal opioids, such as heroin, which was cheaper and easier to obtain. Research showed that people addicted to prescription painkillers were up to 40 times more likely to become addicted to heroin. Between 2000 and 2014, heroin overdose deaths increased by more than 500%, with over 10,000 deaths reported in 2014 alone. Since then, the opioid crisis has continued to evolve. By the early 2020s, synthetic opioids like fentanyl became a major driver of overdose deaths. Fentanyl is far more potent than heroin or prescription opioids and is often mixed into other drugs without the user's knowledge. By 2025, public health data shows that while prescription opioid deaths have declined compared to their peak, overall overdose deaths remain high due to illicit synthetic opioids. This highlights an important lesson. The crisis did not start with illegal drugs, but it eventually spilled over into the illegal drug market because of widespread prescription opioid dependence. Governments have responded more aggressively in recent years. Funding for prevention programs, addiction treatment, and overdose reversal medications like naloxone has increased. Doctors now receive more training on pain management and addiction risk. Prescription monitoring programs help track opioid use and reduce inappropriate prescribing. However, one major challenge remains unresolved: how to effectively treat chronic pain without relying on highly addictive medications. This is where alternative approaches to pain management have gained attention. These include physical therapy, behavioral therapy, non-opioid medications, nerve stimulation techniques, and lifestyle-based interventions. Another option that has generated significant debate is medical marijuana. Research into medical cannabis was limited for many years due to legal restrictions, but studies conducted over the past decade suggest that cannabis may help reduce pain for some chronic pain patients. Importantly, unlike opioids, cannabis is not associated with fatal overdoses. While it is not risk-free and does not work for everyone, it may offer a safer alternative for certain patients when used under medical supervision. Studies have also found that states with legal medical marijuana programs tend to have lower rates of opioid prescriptions and, in some cases, fewer opioid-related deaths. By 2025, more states have expanded access to medical cannabis, and ongoing research continues to explore its role in pain management. Experts emphasize that medical marijuana is not a magic solution, but it may be part of a broader, more balanced approach to treating pain while reducing reliance on opioids. Today, doctors are in a difficult position. They are expected to